For today's video, I'll be demonstrating on how to apply hot and cold compression to a patient. First, I will be demonstrating on how to apply hot compression. Hot compress used to first relieve aches and pain, then increase blood circulation, decrease joint stiffness from arthritis, relieve menstrual cramps, and provide comfort and relaxation. So when should we not use hot compress? If the patient has open wound or broken skin, has poor circulation where heat may damage the tissues, has active bleeding that may increase blood flow, and high fever that heat can raise body temperature. First, I will verify client's identity and explain the procedure. Good day, ma'am. I'm Aphrodite De La Rosa, your student nurse. Can you see your identification band? Can you please state your full name and date of birth?
Kayumi Lopez, November 24, 2007.
Okay, ma'am. Thank you po. So, ma'am, I'm going to apply a hot compress to your left knee to reduce joint stiffness. I will put some towel between your skin and the hot compress. I will also check your skin regularly. So, if you feel any discomfort, please let me know immediately. Okay, thank you. Then I will provide privacy to the patient. Assess client's skin around the area, inspect for any redness, swelling, or bruises. So to make sure it is safe to apply the hot compress. Then assess the client's vital signs and mobility to obtain baseline data and make sure it is safe to apply the hot compress. Temperature. Okay, someone. Ano magiging dito, ma'am? Okay, magiging temperature. Then after assessing the patient's vital sign, I will gather all the equipments needed for the hot compress procedure. The materials are alcohol, gloves, hot compress, washcloth, and waterproof pad. Then I will perform hand hygiene and apply clean gloves. And then position the client and expose only the affected part of the body. And then place the towel and waterproof pad under the area. And then apply the heat compress to the affected area. How's the temperature, ma'am?
Okay.
Is it warm or hot?
Sakto lang.
So please let me know po if you have any feel burn or discomfort. Thank you. And then you may stop the procedure if the patient experiences any discomfort or any unexpected problem. Then after that, we'll examine the treated area for improvement and check the skin for any redness or sensitive to touch. So, okay, ma'am. Then, how's your feeling now, ma'am? Is it better?
Yes.
So, can you rate your pain from 0 to 10?
2 po.
Okay. And then after that, we'll check again the vital sign and compare them with the baseline reading taken before the procedure. So, let's assume that we take na the vital sign of the patient and all the vital signs naman po niya is normal. I'll remove the towel. And then I will remove the gloves and perform hand hygiene. And then we're gonna document the procedure and report our relevant findings and observations. Cold compression is used to reduce swelling, numb pain, used for sports injuries like sprains and strains, and limit cause injury, swelling, and bleeding. Cold compress should not be used if you have impaired circulation, severe hypertension, open wound, and infections. First, we need to verify client's identity and explain the procedure. Good day, ma'am. I'm Catherine De La Rosa, your student nurse. Can you see your identification badge? Can you please state your full name, date of birth?
Eunice Lopez, November 24, 2007.
Okay, thank you po. Ma'am, I'm going to apply cold compress to your left ankle to reduce swelling. I will also wrap the cold pack, or I'll use towel to protect your skin. I will also check your skin every 5 minutes. If you feel any discomfort, please let me know immediately. Thank you. Then I will provide privacy to the patient. Then I will assess client's skin around the area, the color, temperature, or if there is swelling. To ensure it's safe to apply the cold compress. Now, this is the client, vital signs and mobility, to obtain baseline data and make sure it is safe to apply the cold compress. Then after assessing the patient's vital sign, I will gather all the equipment needed for the cold compress procedure. Then the materials are alcohol, gloves, towel, and waterproof pad. Then I will perform hand hygiene and apply the gloves. Then I will position the client and expose only the affected part of the body. And then I will place towel or waterproof pad on the area. And then I will soak the towel in the cold water and squeeze out the excess water, then apply it to the affected area. How does it feel po, ma'am?
Okay na po.
Is the temperature okay or comfortable?
Yes.
Just let me know if you feel too much cold or numbness, okay?
Okay po.
And then remove and soak it again in the cold water and reapply it. Then you may stop the procedure if the patient experiences any discomfort or any unexpected problem. Then examine the treated area for improvement and check the skin for any redness or sensitivity to touch. How are you feeling, ma'am?
Okay na.
So can you rate the pain from 0 to 10?
Hindi po.
Remove the towel. And then check the patient's vital sign again and compare them with the baseline reading taken before the procedure. So let's assume again na kinuha na natin siya ulit ng vital sign and all normal. Then I will remove my gloves and perform hand hygiene. After that, I will document the procedure and report all relevant findings and observations.